السلام عليكم ورحمة الله. شكرا جزيلا على دعوة الإسوار. My topic it will be about recent advances in the treatment of diabetic macular edema and AMD. I don't have any financial interest in relationship to this disclosure. So if we go back to what are the DME treatment evolutions, as we know that the treatment of DME was started in 80s, and the main gold standard treatment was laser. Then we are going to the triamcinolone as an off-label, and the era of anti-VEGF started in 2006 by Avastin, then continue with many anti-VEGF and other steroid. And the latest one was BOVU, faricimab, and Eylea 8 milligram. This is the latest one that including the treatment of diabetic macular edema. Regarding the AMD, also it was before in 1960 laser treatment. Then we go to the photodynamic therapy. Then we start with the era of anti-VEGF until we reach now. We are having also the BOVU, faricimab, and Eylea 8 milligram as the latest anti-VEGF as a revolution and evolution in the management of diabetic AMD. In the real world, it is not replicating the clinical practice. If we go to that, we will see that we are giving a very less number in comparison what was given in the clinical trials. So I will go very fast about the latest anti-VEGF that's available now since 2022 until now. And the first one is brolucizumab. The brolucizumab is very strong anti-VEGF and one of the most strongest anti-VEGF that leading to the dry of the macula, and it was giving as a loading 5-dose Q6 week, not the usual every 4 weeks, and it was doing very well. But unfortunately there was an issue regarding the inflammation, intraocular inflammation, and the safety profile, even though latestly seen that in case of diabetic macular edema there is no difference between the anti-VEGF and the brolucizumab, other anti-VEGF. There is one case. This is a diabetic patient, more than 10 years, presented with, and patient was having an diabetic macular edema, and we give a pre-injection. We found that it is very high central retinal thickness, but within one just injection, you can see the effect of the BOVU in the drying of the macula. So, and continue in the other eyes. The other one, which is now still we are latest one, is the faricimab. And it is also a very good one because we have a dual effect and dual mechanism as an anti-angiotensin 2 and anti-VEGF A especially, and it was giving a very prolonged effect because of the dual effect of these two mechanisms. The most important about this new era of the drugs of anti-VEGF, they are looking for the extension of the treatment. So they are giving every 8 weeks to 12 weeks and 16 weeks. In the case of faricimab, we reach up to Q16 weeks in about 60% of our cases. Also, one case, this is very nice case. It was treated with several injection in United States. Then it came to me. I treat her with anti-VEGF and then also dexamethasone, and unfortunately never go to a dry and improvement. But when we try and the anti-VEGF faricimab, we can see that there was an improvement, and this is, you can see faricimab. After only one injection, there was a very good effect, and the first time of drying of the macula after 3 years without any improvement with other molecules, even with steroid. This is on after the 3rd injection, and it is very good drying. So the latest now, which is the aflibercept 8 milligram, now about 2 years we are using, or 1.5 years, and this is a photon study about that one. And the most important, the durability of this medication, that we can reach up to Q12 in 93%, and even Q16, and now Q20, and the extension one, they are talking about Q24 weeks that we can give one injection. That means we are going to decrease the number of injection and the burden of the injection on the healthcare system and the patient and the doctors also. This patient was treated with Eylea as an AMD, and I do extension actually because it's starting. We give not jumping to Q3 months or Q12. We start by 2 weeks by 2 weeks, and we can see there was an improvement in the drying of the macula from the first 3 after the 3 injection. Then we start extension of this. We do treat and extend by 2 weeks, and we reach now up to Q12, and maybe we will make it more after a while, so we can reach up to Q16, and we will try to see if we can continue up to Q20. And there was an improvement in the visual acuity and drying of the macula. So now also we want to tackle some very important things. That's the new emerging therapies for neovascular AMD and diabetic macular edema. And this is very important. Now there is a rapid expansion of non-vascular endothelial growth factors, growth of gene therapy for sustained suppression, novel biologic small molecules, and topical agent, focus on durability, non-responder, and treatment burden of the patient. Key novel approach, there is a gene therapy, and there is vascular endothelial growth factor CD inhibition, clerikine pathway inhibitors, integrin inhibitors, and topical corticosteroid innovation, long-acting biologics, and polymers conjugate. So there is many things now going on and study. Some of them actually they are succeed and reach to maybe to the latest primary endpoint, and some of them they are not that improving and they stop. One of them, the gene therapy agent RGX-314. This one also trial in AMD and DME. The goal one-time treatment with long-term vascular endothelial growth factor suspicion. So it will be only one-time trials. Another one, the one is called ADVM-022, and this intravitreal AAV 7 8 vectors, sustained aflibercept-like expression trial in AMD and DME, and this one also in trying to be continue the treatment. The one we mentioned also in the early vascular endothelial growth factor CDB pathway inhibitions, and this is how the difference between the previous one and this one. They are also affecting, in addition to vascular endothelial growth factor A and B, and also placental growth factor. Also there is another one which is C and D pathway, and so that we are going to inhibit most of the receptors and prolong the effect of these drugs for treatment of AMD, and maybe also after that it will be for DME. Long-acting biologics, this is another one. This is anti-VEGF antibody biopolymer conjugate also, and there is also I-201. All of them, they are looking for treatment of diabetic macular and AMD, and they are a novel intravitreal agent combination strategy phase half in DME and AMD trials. These all are molecules that in trials, and maybe it will be published very soon about the effect of treatment of diabetic macular edema and AMD. Also non-vascular endothelial growth factors pathway. So previous we are talking about vascular endothelial. This one here none, like plasma kallikrein inhibitors for DME, especially anti-VEGF insufficient responders phase 2 trials. But this one trials unfortunately failed to meet the primary endpoint of improving the vision. Other one is integrin inhibitors, also in this one non-vascular endothelial growth factors, and this is for phase half in neovascular AMD, and we are waiting if there is any result going to happen in the end primary point. Topical, and this is also another way of treatment, not just only injection. They are looking for some treatment without intravitreal injection, like topical and non-injectable therapies like OCS. This is a topical dexamethasone, non-vertical suspensions, and this is in a phase 2-3 in DME. Potential first meaningful topical options for center involving DME. This is all showing all of these molecules that they are ongoing for study clinical trials. So in conclusions and take-home message, new drugs are sufficient toward durability and multi-pathway targeting. Gene therapy might redefine management for high-burden patient. Non-vascular endothelial growth factor pathway vascular endothelial growth factor FCD and kallikrein, integrins, and targeting non-responders. Topical and systemic agents may expand options beyond the injection. Thank you very much, and I would like to invite you to MIOM. The 8th, it will be that held in Dubai from 30th of October to 1st of November in UAE, Dubai. Thank you very much.
Thank you very much, Professor Mohammed Al Amri, for this very informative lecture.